Okay, welcome everyone, and thank you for joining us today for this webinar. The goal of this webinar is to share some high-level information on vulnerable road users, safety assessment, and to lay out our plans for completing this effort. My name is Juan David Pava. I am the Safety Programs Unit Chief with the Department of Transportation, Illinois Department of Transportation. I have a few co-presenters with me today, so at this time I will allow them to introduce themselves, and we're going to go ahead and get started with Kim Collodi. Kim, go ahead.
Good morning. Kim Collodi with Jacobs and managing and working with the team on this. I'm really excited to talk with you for this webinar and kick off the Vulnerable Road User Safety Assessment. I'll pass it to Mahdi Rajabi to introduce yourself.
Thank you, Kim. Hello, everyone. This is Mahdi Rajabi. I'm also with Jacobs. I'm happy to be part of this project to do some of the data analysis on this project, and I will be presenting some slides today as well. Thank you. I'll pass it to Chad.
Hi, I'm Chad Crater. I am also with Jacobs. I'm a GIS analyst, and I will be demonstrating a public web application that users will be able to use to enter in information later on in this slideshow. And I'm going to pass it off to Todd Schmidt.
Good morning, everybody. I apologize up front. I'm having some issues with my webcam. I could turn it on, but it's a big conference room and I'm pretty far away from the camera, so you won't be able to see me. So I'm just going to leave it off for now. But my name is Todd Schmidt, and I am a safety and mobility specialist in the Illinois division from Federal Highways Department.
Perfect. Thank you. Thank you, Todd, and thank you, team, for the introductions. Okay, before we get started, I want to let you know that the chat will be active for the duration of the webinar. So please feel free to submit any questions or comments you may have throughout the presentation, through the webinar. If time allows, we will address as many of the questions as possible. I also want to let you know that this webinar will be recorded, and we will make it available to everyone that attended. And we may also circulate the recording to the distribution list that we have. Okay, so this is the agenda for today's meeting. We are going to first talk a little bit about the background of the Vulnerable Road User Safety Assessment, as well as safety initiatives for vulnerable road users in Illinois. Then we're going to touch on transportation trends in transportation safety specific to vulnerable road users. Then we're going to go over the Illinois VRU safety assessment process and how we plan on tackling this effort. And then we are going to have ways in which everyone can get involved in making sure that we come up with an implementable product at the end of this effort. Okay, so can you go to the next slide, Kim, please? Okay, perfect. So first, what is a vulnerable road user? Just I want to make sure that we're all kind of in the same page as to what is our definition for what a vulnerable road user is. So a VRU, or vulnerable road user, is a known motorist with a fatality analysis reporting system, or FARS, person attribute code for pedestrian, bicyclist, or other cyclist, or a person on a personal conveyance, or an injured person that is or is equivalent to a pedestrian or pedocyclist. So a vulnerable road user may include people walking, biking, or rolling. This includes highway workers on foot, since these are in a work zone, since these are considered pedestrians. And also, I want to make sure that we're clear that vulnerable road users do not include a motorcyclist. Before I go any further, I do want to give some time to Todd Schmidt with Federal Highways to maybe give us a little bit more of the Federal Highways perspective as to what is the purpose and goals of this vulnerable road user safety assessment. So Todd, I'll hand it over to you.
Okay, great. Thanks, Juan. Again, having a little camera issue, so I'm just going to go without my camera. Again, my name is Todd Schmidt, and I'm a safety and mobility specialist with the Illinois Division of the Federal Highway Administration. As part of the bipartisan infrastructure law or bill, all states are required to complete a vulnerable road user or VRU safety assessment no later than November 15th, 2023, either as part of their strategic highway safety plan or SHSP update, or as an addendum to an existing strategic safety highway plan. A VRU include, as Juan mentioned, people walking, biking, or rolling. Vulnerable road users account for a growing share of all roadway fatalities in the U.S. in recent years. According to the National Highway Traffic Safety Administration, or NHTSA, more than 38,800 lives were lost to traffic crashes in 2020. That is the highest number of fatalities on our roadways since 2007. Compared to 2019 data, bicyclist fatalities were up 9.2% and pedestrian fatalities were up 3.9%. In addition, early NHTSA estimates for 2021 fatalities project pedestrian fatalities increased by 13% from 2020 to 2021, and bicycle fatalities increased by 5% from 20 to 2021. In response to the current crisis in traffic fatalities, the United States Department of Transportation, or USDOT, released the National Roadway Safety Strategy, or NRSS, in January of 2022, and just recently released the 2023 Progress Report on the NRSS. The NRSS outlines the USDOT's comprehensive approach to significantly reducing serious injuries and deaths on our nation's highways, roads, and streets in pursuit of the goal of achieving zero deaths. FHWA recognizes that zero is the only acceptable number of deaths on our nation's roads, and achieving zero is our safety goal. FHWA therefore encourages states and other funding recipients to prioritize vulnerable road user safety in all federal highway investments and in all appropriate projects. At the core of the NRSS is the adoption of the Safe Systems approach, which addresses the safety of all road users, including those who walk, bike, drive, ride transit, and travel by other modes. It involves a paradigm shift to improve safety culture, increase collaboration across all safety stakeholders, and refocus transportation system design and operation on anticipating human mistakes and lessening impact forces to reduce crash severity and save lives. Vulnerable road user safety should be fully considered in a state's transportation investment decisions, from planning and programming, environment analysis, project design, and construction, to maintenance and operations. States should use a data-driven safety analysis to ensure that safety is the key input in any decision made in the project development process for all project types, and fully consider and improve the safety of all road users, especially vulnerable road users in project development. FHWA encourages states to use the lessons learned from the vulnerable road user safety assessment process to also identify policies, rules, and procedures that may be barriers to safe travel by vulnerable road users and steps to change them. The VRU safety assessment is to include the following: a data-driven process to identify areas of high risk for vulnerable road users. So what does that mean? It means using data to look at historical trends, when and where VRU serious injuries and fatalities are occurring. So a spatial temporal analysis to identify high risk areas. Also looking at the demographics of both the identified high risk areas and the VRU fatalities and serious injuries. Also consultation with local governments, MPO, regional transportation planning organizations, and other stakeholders that the state may not have worked with before that represent the high risk areas. The assessment should describe the process used and to consult with required entities and other stakeholders about high-risk areas, including those in the high-risk area. Provide a summary of the outcomes, so the safety concerns and potential solutions that were identified through the consultation for each risk area. And then finally, develop a program of projects or strategies to reduce safety risk to vulnerable road users in areas identified as high risk. In addition, the safe system approach should be considered throughout the development of the VRU safety assessment. Equity is a key component in the VRU safety assessment. Fatalities impact communities differently, particularly for people not in a vehicle. Bicyclists and pedestrian fatalities are overrepresented for American Indians, Black or African Americans, and Hispanic or Latinos compared to total bicyclist and pedestrian fatalities. Therefore, states should ensure that the vulnerable road user safety assessments address equity by considering the impacts to these communities. States are responsible for involving the public, including by seeking out and considering the needs of those traditionally underserved by existing transportation systems and underrepresented populations. So quick recap, the bipartisan infrastructure law required each state to develop a vulnerable road user safety assessment that is to be completed no later than November 15, 2023, either as part of the SHSP update or as an addendum to an existing SHSP. Each state must update the vulnerable road user safety assessment with subsequent SHSP updates, and states are required to update the SHSP no later than 5 years from the previous approved version. The FHWA Illinois Division is excited to support IDOT in the development of the vulnerable road user safety assessment. And with that, I'm going to turn it back over to Juan.
Thank you so much, Todd. And you guys will see that there's going to be a little bit of duplication. I'm going to try to dissect all of this information that Todd gave us and give it a little bit more of a look as to where we are looking at these vulnerable road users from an Illinois standpoint. Okay, so let's start on that. So what is the VRU safety assessment? So as Todd mentioned, to achieve the vision of zero fatalities and build a better roadway system, vulnerable road user safety should be fully considered in the state's transportation investment decisions. From planning and programming, environmental analysis, project design, and construction to maintenance and operations. States should use data-driven safety analysis to ensure that safety is a key input in the decision made in the project development process for all project types, and to fully consider and improve the safety of all road users, especially vulnerable road users in project development. So the vulnerable road user assessment is a process to identify safety trends, policies, rules, and procedures pertinent to safe travel by vulnerable road users, and to identify any steps to improving them. As Todd mentioned, the vulnerable road user safety assessment is required to be part of the Strategic Highway Safety Plan, or to be submitted as an addendum to the Strategic Highway Safety Plan. Next slide, please. So before we diving into the VRU safety assessment requirements, it is important for us to review what we currently have in the books for statewide consideration of vulnerable road user safety. So the Strategic Highway Safety Plan, which was published in 2022, identified 5 emphasis areas for the strategic implementation of safety countermeasures. These emphasis areas are safe behaviors, safe road users and vehicles, safe roads, post-crash care, and safe system administration. Each one of these areas addresses an area that may be approached differently, but it was determined to be integral for the implementation of a safe system approach. In addition to the 5 emphasis areas that are shown in the slide, we identified 3 priority focus areas through data analysis and stakeholder input as areas where there was an opportunity for significant safety gains. And those areas are speeding and aggressive driving, which is part of the #1 emphasis area of safe behaviors. Roadway departure, which is a part of emphasis area #3, which is safe roads. And pertinent to this discussion today is pedestrians, which is part of the emphasis area #2, which is safe road users and vehicles. So from the get-go, we are being cognizant that pedestrians is a specific area of road users that we are interested in addressing separately because of its own constraints. Next slide, please. Okay, so there are 2 main groups of users that make up the majority of VRU fatalities and serious injuries in Illinois, and those are pedestrians and bicyclists. Both of these areas are covered specifically by the Strategic Highway Safety Plan, or SHSP. So first, the pedestrians account for more than 15% of fatalities statewide. Another troubling statistic is that pedestrian fatalities have increased by more than 37% between the years of 2013 and 2020, and pedestrian fatalities typically do not overlap much with other factors. Therefore, these type of incidents need a specific and isolated attention to be addressed. The Strategic Highway Safety Plan laid out a set of broad countermeasures to address these concerning trends. knowing that a more focused approach was going to be taken during the development of the vulnerable road user assessment. The countermeasures identified for the pedestrians in the SHSP include reduction of exposure, improvement of visibility, improvement of awareness, and speed control measures. So we see that we are taking these into consideration in the SHSP. I got a comment that you cannot see the slides. Anyone else have an issue looking at the slides?
I can see the slides.
Okay, thank you so much. Okay, can we go with the next slide, please? Okay, and the second group of users that make up VRU fatalities is bicyclists. So within the strategic highway safety plan, we also have a bicyclist area. And although the portion of overall fatalities involving bicyclists in Illinois is much smaller than those involving pedestrians, and bicycle user fatalities and serious injuries have generally decreased in the last 7 years, we recognized that these users are more vulnerable to increased severity incidents, and their safety needs require a more focused consideration. So the SHSP also included strategies to address bicyclist safety and left room for the implementation of additional strategies and countermeasures to be identified by this effort. And the strategies for bicyclist safety are shown in the slide. Okay, now that we have covered what we have currently in the books, we can get into what we are trying to accomplish through this VRU safety assessment effort. As Todd mentioned, there are 5 components required by federal highway guidelines for the development of the VRU safety assessment. The first component is an overview of vulnerable road user safety performance. In this component, we will evaluate ongoing efforts and past performance of VRU safety programs statewide. So we're going to see, how we have done from a safety perspective on the performance of VRU safety, and also identify what ongoing efforts we have to try to avoid duplication of efforts or overlapping of programs. The next component of the VRU safety assessment is going to be a quantitative analysis. In the quantitative analysis, we will gather and mine many data sources, including crash data, transit data, inventory data, and equity data, among others, to help us identify trends, areas of overrepresentation, and opportunity areas, as well as help us identify countermeasures that are appropriate for the areas of improvement. The findings of the quantitative analysis will be shared with the pertinent stakeholders, and we will present the findings in a summary of quantitative analysis. The third component of the VRU safety assessment is stakeholder consultation. We understand that stakeholder consultation is integral for the development of relevant products. This will be accomplished through a series of webinars, such as this one, interactive tools, such as what Chad will present later, and also we'll have a series of different meetings that are going to be more focused for different people. Details of the stakeholder consultation will be presented in the final document under a summary of consultation, but we may also have different documentation to share with specific stakeholders. The next component of the VRU safety assessment is a program of projects or strategies, which will be identified through coordination with stakeholders and with the aid of all the other components that I previously discussed, to ensure proposed solutions are feasible and relevant to the goals of this effort and to the goals of each stakeholder. So we don't want to have blanket statements out there that are not applicable for the needs of your communities. Now, the last component that in reality is an overarching, not only VRU safety assessment, but on the SHSP and other safety approaches, is the consideration for the safe system approach, which recognizes that death and serious injuries are unacceptable. Humans may make mistakes. Humans are vulnerable, and responsibility of safety is shared by all stakeholders. safety is proactive and redundancy is crucial. So safe system approach is going to be considered throughout all the different components of the VRU safety assessment. Also, it's very important for us to address what the VRU safety assessment is not. So the VRU safety assessment is not an implementation plan or a strategic plan. There are other documents that cover this need. Also, the VRU safety assessment will not be identifying gaps in the bike or pedestrian network system. We will not be developing policy, but we may identify areas in which policy needs to be developed or updated. And we will not be determining eligibility of funding. There are other programs that address these needs. Next. Some of this, the needs that I addressed in the previous slide are covered by some other ongoing initiatives in Illinois, such as the local road safety plans, the active transportation plan, which is ongoing, and many of you may be involved in the development of this plan, or the Highway Safety Improvement Program, or HSIP. As Todd mentioned, another very important factor to be considered with this effort is equity. It is important to have a clear understanding of what we mean by equity in the context of this effort. For that, we have developed a definition and a goal to ensure that we stay focused. For this effort, we understand that equity considers the distribution of resources that is proportional to the need based on fairness and justice. Further, it is imperative that we recognize that historic inequalities can lead to unequal outcomes. And despite equal resources today, lastly, the equity pursues equal outcomes through resource distribution that is sensitive to the context and histories. So we want to make sure that we keep that into consideration. Now, to help us further consider equity through the development of this assessment, we posed a set of questions that will help us ensure that we continue to keep equity in mind. The first question that we should be asking ourselves is, how should historic underinvestment impact safety decision-making today? The next question is, what transportation needs are not being served due to safety issues? Next question is, how does traffic or public safety impact the broader goal of mobility? And the bottom line question is, how do we create more safe trips for all users? Now, in order to help us take a more data-driven approach to the determination of equity in the context of transportation, we will rely on the Justice 40 dataset to help us identify areas that are considered disadvantaged. The Justice 40 dataset encouraged states to invest more heavily in areas considered disadvantaged. The transportation disadvantage metrics take into consideration multiple factors that acknowledge that non-voluntary or zero household vehicles hinder mobility and make active mobility and use of transit much more critical. They also consider that or acknowledge that poor walkability increases commute times and impacts safety. It also acknowledges that economic disadvantages exacerbate transportation burdens. And lastly, it acknowledges that unsafe walking, either from an infrastructure or public safety perspective, may make economic resources inaccessible and further providing more levels of disadvantage. So the Justice 40 tool will help us further draw correlations between disadvantages, areas of disadvantage, and safety trends to allow us to present a much more relevant and complete assessment for stakeholders. So with that, I will hand it over to Kim Collodi, and she is going to walk us through some of the preliminary data and national data trends.
And Mahdi Rajavi is going to jump in and provide us the background of the data analysis.
Thank you, Kim and Juan. This is Mahdi Rajavi again. I'm with Jacobs, and I will be involved in some of the data analysis for this task. I will be covering some national trends as well as statewide trends, and and some contributing factors that we have observed so far. Of course, we have not gone into the data analysis yet, so we are in the beginning stages. But just to give us like an overview of where we are in terms of the overall trends, we will have some figures to look at. If we can go to the next slide. So here we're looking at a 40-year span of total fatalities nationwide, as well as VRU fatalities. And we are breaking down the VRUs into pedestrian fatalities, bicycle fatalities, and also like the other fatalities that are associated with VRU, personal conveyance, and others. As you can see, pedestrian fatalities are most of the VRU basically is pedestrian, as you can see, and then we have bikes, and a smaller portion is for the other VRU fatalities. What I want to focus on this figure is the overall trend of fatalities. We have the national numbers on the left. The overall numbers are going up since 2009, 10. The numbers have been increasing. With that, VRU crashes, fatalities have been going up as well. But if you can notice, like the rate of the increase for VRU has been higher, and we have a graphic after this slide to confirm that. But what I wanted to mention here is that the number of pedestrian fatalities has been the highest in the last 40 years. In 2021, it has been the highest in the last 40 years, which is striking. So that kind of explains why we need to focus more on pedestrians. There has been up and downs, but in the fatalities nationwide, but this time around seems like pedestrian fatalities or the proportion is really going up. If we can go to the next slide. Here, we do have the total fatalities still on the left, the dark blue line. But we also have the US pedestrian fatality proportion, and also the dots show, the dashed line show the 2021 proportion, which is 17.4, and has been the highest in last 40 years. If we can go to the next slide, is where we have the data trends in Illinois. We're going to look at similar trends for the state of Illinois and some deeper analysis. Here we're looking at, again, total fatalities in Illinois in the same time frame, last 40 years. And similar to what we saw for the nationwide, we have pedestrian fatalities, bicycle fatalities, and other VRU fatalities. We didn't have those two numbers for 2021 and 2022, so we only had pedestrians we're using FARS data set and also the state data set. So that's why you don't see the bicycle for 2021 and 2022. But we did have pedestrians, so we're showing that, and it has been going down in 2022, which is a good thing. And if you go to the next slide, this is where I'm comparing the proportion of pedestrian crashes for the state of Illinois compared to proportion of pedestrian crashes nationwide. That's the green line and the dark blue line. And if you can notice, around like 2009 to 2011, we used to be above national average in terms of proportion of pedestrian crashes, and now we are below the national average, which means pedestrian crashes has not been going up in the state of Illinois with the same rate as they are going up nationwide. So we are doing a little better in terms of the proportion of pedestrian crashes, and that's basically how how it compares to the nationwide. If we can go to the next slide. So on this slide, I'm showing a heat map of pedestrian fatalities since 2005 to 2021. Around 95% of total VRU crashes are happening inside the MPOs. Around 68% of fatalities are happening in the Chicago area, VRU fatalities. For fatalities, around 75% of total fatalities are happening inside MPOs. So if you consider total crashes, it's 95%. If you consider only fatalities, 75%. So we're gonna for the analysis, we're gonna consider, of course, like the urban areas differently than rural areas. We may need to consider more systemic analysis for rural areas where crashes might not be clustered at the same location, where in urban areas we might, focus on an approach that can address the trends for the urban areas. So basically just showing how those crashes are dispersed in the state, and how we need to find the best approach for different types of area developments that we have in the state. We can go to the next slide, is where we are looking at the contributing factors. And I'm just showing this as an example. Again, we have looked at a lot of different trends, but some of the important things that I think is good to note, and this figure is that for pedestrians, around 25%, which is 1 out of 4, are hit and run. Pedestrian fatalities and serious injuries are hit and run crashes. Around 35% are happening at signalized intersections. Around 30% are happening at the subcontrolled intersections. Of course, intersections are one of the main facility types that there is that conflict between different modes of travel. So we want to focus on those. About distracted and other behavioral factors. I think it's important to note that for most of those hit runs, we don't get the driver condition in the data set because it's either not reported or it's unknown. So that could affect a lot of the statistics that we get from the crash data with regard to the driver condition at the time of the crash. And we are aware that distracted driver is underreported. So we're looking at other measures to kind of estimate if the driver was distracted. So there are other surrogate measures that we're looking to use for distracted. Speeding, of course, as Juan mentioned, is again one of the most contributing factors in terms of the human behavior that we see on this graphic that needs to be addressed. Again, with hit and run, those numbers could change because we're missing 25% of pedestrian crashes, data for pedestrian crashes because of the hit and run. I think that's what I had for this graphic. If we can go to the next slide. Yeah, I think with that, I pass it to Kim.
Excellent. Thanks, Madi.
Thank you.
And this is where you all come in. So we really appreciate the opportunity to talk with you for this kickoff meeting. As Juan and Todd mentioned, the timeline is pretty concise. This VRU assessment needs to be officially to headquarters mid-November. And so this needs to go through IDOT leadership as well. So we need to make sure that we've got enough time in there to complete it. So here we're showing that we're completing with the analysis and the document by the end of September. And we're in this beginning stage right now where we're obtaining background information, and we hope to get some of that background information from you next. So we'll talk a little bit more about what that background information is. And then we move into the data analysis. So the data analysis is going to take quite a bit of time because it's going to incorporate the analysis that we receive or the data that we receive from you, as well as, you know, other stakeholders and IDOT. And then with the data analysis, we're going to be incorporating that stakeholder engagement piece. We want to hear from you on what you think is going to be most effective so that we can bring that into project prioritization. So we'll be meeting with you again in May. We'll talk about that, and again in July. And then, of course, we work on the document after that to bring it all together. So for the stakeholder engagement piece of it, of course, we've got our kickoff today with this webinar, and we are going to walk through some online input to gather information. Then in May, we're going to have a series of discussions, and those discussions are going to be more hands-on. So it's going to be probably multiple virtual meetings for those stakeholder engagement discussions so that we can make sure that we've got statewide coverage. In the first series or sessions, we're going to review a more specific data analysis, more specific than what we showed here today. We're going to identify some of the needs across the system, as well as strategies that you may have that are already ongoing or projects or plans that you already have in the works so that we can incorporate that in the analysis. Then we'll incorporate that in the analysis in June, and then we'll come back in July with some results of those prioritized kind of recommendations for consideration. So then we would have a second series of meetings that again are more hands-on, where we can review some of those suggested projects and locations, and then obtain input from you to make sure that those are in alignment with your community values, interests, and initiatives that you would like to proceed with, and really takes into account some of those things that you might have already going on right now. So that will be in the second series. And then after that, we'll be able to bring that into the document and utilize that for implementation as part of the VRU. So for the website, this is our first opportunity to get some input directly from you. Chad Crater and team have developed a website where you can actually go in and geolocate some issues that you're seeing, as well as recommended countermeasures and treatments. I am going to stop sharing my screen so that, Chad, you can share yours and give us a live demo.
All right, thanks, Kim. Can you guys see my screen?
I can see it. It looks great.
All right, perfect. So I'm going to review the online application that we've put together. This is a web-based application accessed via URL. So it is accessible from a desktop computer or a mobile device, such as a smartphone, a tablet, anything with a web browser. So it starts off, we do have a disclaimer in the very middle of the screen, just saying that this is a public-facing website and that anybody can add information to this. There are free text fields in this application. Users can enter whatever they want. You know, IDOT's not responsible for the information that the users put in. Every user is required to accept the terms and conditions, hit OK. With that, we have kind of a general look at the whole map here. On the top left, you do have your standard mapping tools to zoom in and out, to go to the default extent, to go to the location that you're currently at. There is an address search, pretty standard. Up at the top right, there are 3 tools. There is a legend that tells you what each category is. So we have accessibility, dangerous driving, maintenance issues, request bicycle facility, transit access, request pedestrian facility, and other. We do have a base map gallery, which does allow you to switch between the default base map, that we're looking at here, and you can switch to imagery, and there's a number of different types and styles in here that you can switch between. And then the third tool in the top right is really the main tool that is used to place the issue on the map and fill out all the accompanying information to that. So I'm going to go ahead and just zoom in. We'll zoom in down. You can use the address search. You can use the zoom in and out buttons. I am just using the wheel on my mouse to zoom in. So over on the right-hand side, I'm going to go ahead and pick this dangerous driving category. And we'll just go ahead and place it right here on the map. And so the blue dot represents the temporary location that you've set. And then in this right panel over here, you can see that we have set the category as dangerous driving. If you change your mind and that's not what you wanted to pick, you can actually switch that. There are fields on the right-hand side for full name and email. They are not required, but they are there for any user that wants to put it in. Organization, what type of organization the user belongs to. Location dropdown. So in this instance, we're going to go with public park. And then users affected, we'll go with pedestrians. And we selected dangerous driving, so I'm going to say drivers are not stopping at the stop sign. Something along those lines. There is a little checkbox here if you want to edit the geometry, decide you want to move the point to a different location. We're going to keep it. And I'm going to go ahead and hit save, and that's going to submit it. And so now that location is on the map. And once the user submits it, it's locked in. So we did that so users can't necessarily go back through and edit other people's information and things like that. So I can click on it, I can see the information that's there, but I can't change it. So we'll go and we'll add in a second one. We'll do an accessibility. Don't have to put in an email. And we'll do residential area, users affected. We'll say wheelchair users. And so that's there. And as you go through, as users keep adding it in, those points will pop up, and you can click on them. There's also a little pop-up information for it as well. And those will keep going in as users add them in. And it is accessible to anybody that has access to the URL. And that concludes the demonstration that I have. And I'm going to send that back to Kim.
Thanks, Chad. Thanks for reviewing that with everyone. And there is the link in the chat to this site. So folks can go in and actually access that now to start inputting information or insights that you see. And one team, if there are any questions or things that you'd like to add, please go ahead and share that now.
No, so there's there was a question from David Schneider in the chat box asking if a combination of bike and pedestrian accessibility be shared in a single spot? The answer to that is yes. You can have as many of those, I guess, points pinned to a single location as necessary. And we do encourage for all different types of users and stakeholders to provide their input, because these data will help us better understand what are the needs of the community, the needs of the users.
Thank you. And there's another question too about, is it intended for state routes, county residents?
So this is intent for any public road. We don't want to limit the input for state routes only, because we believe some of the findings from this effort will be beneficial to the different stakeholders. So please just provide any input related to pedestrian, bicycle, and other vulnerable road user safety that you may have. I think that the more robust the data is, the more value the data set will have. So it's not limited to state roads only.
Excellent. Thank you, Juan. So we'll have some questions at the end, but certainly you can go in and start providing some information there for us to utilize throughout the project. And how will that information be used? We are going to use it for project development. So you'll see over here on the right, we're obtaining the data. And the data is, there's a wide variety of data sets that we are compiling for this, from transit usage to LiDAR, bike lane continuity, and sidewalk continuity, and some other data sets that have been shared with us by agency. So we appreciate being able to utilize those to help improve and prioritize the system. Part of the information that will be used is the information that you're sharing with us today, and additional stakeholders will be providing using that online portal. So as we continue to gather that information, then we'll continue with the vulnerable road user safety trends that Madi presented today. So that's kind of an initial slice of the data. And as we get some additional information, we'll be able to look at that in greater detail, and appreciate some folks in the chat are talking about some of those layers that may be used for equity as well. So that's excellent information. Thank you for sharing that. Is that will all be incorporated in this, establishing some of those trends to get a better understanding of vulnerable road user issues really across the state. So then, based on that information, again, we'll take that and we'll conduct a data analysis so that we prioritize locations for improvement statewide, or potential improvement statewide. And again, as we prioritize those, that's another opportunity during the next webinar to get into more detail on kind of what we're seeing, and then what also you're seeing on your system as well, so that can be factored in. We'll also be factoring in the countermeasures. We really like to use, proven effective safety countermeasures for the reduction of pedestrian and bicycle fatalities and serious injuries. So we'll be using the latest research to make sure that we are accounting for that, and also looking at some of the unintended consequences by some of the recommendations, and then again bringing that back to stakeholders to get your input and feedback to make sure that that's in alignment with your overall approach. And we'll use that for project development. And then, so we'll be identifying those countermeasures for those locations across the state, developing those as projects or preliminary projects, and then receiving your input and utilizing that. So for the analysis approach, again, this is really based on the data that we have and that is available, but we really like to do this from kind of multiple perspectives. And one, look at a region-wide or a geographic-wide network screening process to prioritize. Ideally, we would like to use a systemic approach, which looks at not only crashes, but also contributing factors that are associated with crashes. So those locations where we might be able to introduce some safety treatments for proactive intervention. There are new crash prediction models that are going to be incorporated in the next highway safety manual. So we hope those are available to utilize with kind of a crash prediction process as well through this project. Of course, data-driven, as Todd mentioned, it is required that this be a data-driven process. The data will drive the discussion. And a lot of it is using the information provided, as well as the Justice 40 information that Juan reviewed, another review that may help us provide insights on equity, in addition to the information that you're providing us. So really using that and crowdsource stakeholder information, because we know with pedestrian and bicyclists, some of the exposure information is a little bit more limited. It's a little bit more difficult to get that, but we really hope that by, talking and engaging with you, that we can gain some of those insights and also make sure that these initiatives are aligning with those that you have in place. And as you've seen from what Chad also already shared, is that it will be technology enabled, that we really want to create, kind of visualization tools, so that there are resources that you'll have later to integrate into your programs. And we are using kind of machine learning techniques in order to improve efficiencies, and those are processes that we've really developed over time working with state and local agencies on safety analysis. Depending on the data that's available, we really want to supplement the engineering data with other geometric information. So sidewalk densities, intersection skew angles, and intersection sort of complex intersections that might be difficult to navigate by bicycle or pedestrian. That will help us prioritize locations for potential improvement. Intersection density or other surrogates to identify where there are clusters of pedestrians and bicycles will be meaningful input to the analysis. And then, of course, as we talked about, your input from stakeholders, and using that to really identify the patterns, issues that might be coming up that are sort of common issues. Maybe it's speed or hit and run or some of the other things that are coming out of the information that we're gathering and utilizing for this. So data needs. Again, we're really at the beginning stages here in the project where we're obtaining information that is available and gathering that. So that's our ask to you is, as you have additional data resources, please let us know about that so that we can make this really as rigorous and as meaningful as possible. So some of the types of information may be infrastructure, exposure, as I mentioned, any ongoing projects or initiatives that you have, especially if they're geolocated, because then we can bring it right into the analysis automatically. Certainly those treatments and countermeasures that you're finding most effective, but also countermeasures and treatments that you're finding not as effective, or something that your jurisdiction may not be interested in implementing. Those are the things that we also want to capture and understand so that we can bring that into the analysis. So again, this is our first kickoff meeting here. And in the next meeting that we have, we'll have an opportunity to get into more detail, looking at specific geographies across the state, and kind of take a deeper dive into understanding the data, but also what other additional data sources might be available, so that we make sure that this is really helpful and meaningful to you. So with that, here's our information, our contact information, an email address specifically set up for this initiative. So, reach out to us through that. And then also, I see you, Juan, you're back.
Yes, and before we open it up to Q&A, I do want to mention that if you have another data source that you think may be relevant to this effort, please do not hesitate, reaching out to us, and we can have a conversation as to how we may be able to incorporate this data, because it's really important for us to have as robust a analysis as possible. We want to have as much data as possible, so we'll do everything we can to try to incorporate any data sources that are are provided to us. Now, as Kim mentioned, it is much better for the data sources to be geo-referenced, as this is a way in which we can correlate data as well. So.
I stopped sharing. Oh, go ahead, Sophia.
I was just going to say there's a couple questions that have come in from the chat related to the online input tool. One of them is, would you like the tool to be publicized to the general public, or would you prefer the input be from agencies on the call? And sort of a follow-on to that, is there a PDF guide for using the tool?
Okay, so currently we do not have a PDF tool, PDF document for the use of the tool, but that is a great idea. I think that's something that we can easily put together. Before, in the time that it takes us to prepare that, we will have this recording available to everyone. So we will share the recording of this webinar with everyone, and the portion of the use of the tool will be within that as well. So you can use that as kind of like a go-to in the meantime. Regarding a distribution of the tool, I think that people within agencies and interest groups may be able to provide more detailed and valuable input. However, we don't want to discourage you from sharing this tool with other members of the public. This, as Chad mentioned, this is a publicly is an open source, so anyone can go in there and provide input. We will have to go through a process of filtering the data after everything has been input to ensure that everything that we are using for the data analysis is relevant and is valid. So we encourage you to share this tool with anyone that you think may be able to provide valuable input.
Another tool-related question. Will the data from the tool be made available at some point in the process, the results that people are entering?
We haven't discussed that yet, but we are open to having that discussion later. As we want to make clear that this is going to be a completely grassroots and crowdsourced data. So we are dependent upon what people provide in the tool itself. We will have more discussions about what data is being acquired from this tool in the following meeting. So this is something that we can entertain at a later time.
A question about the equity data. Do the disadvantaged areas include rural counties?
Yes, it does. So the equity data is nationwide, and they look at every single census tract, and for every single census tract, they determine levels of disadvantaged based on different factors. So I guess short answer is yes. It looks at heavily urbanized to very rural census tracts independently and not comparatively. So those will be covered as well.
If there's any additional questions that people have, you can drop them into the chat. There's some questions about adding layers to the tool. Can a layer be added for fatal pedestrian and bike crashes? And also, is there a time frame for adding input to the online tool?
So I am assuming that the addition of layers is in reference to this input tool. We did not intend to input crash data within this tool. We are going to be looking at the crash data separately from our crash data layers. I believe that the intent of this data was more to allow stakeholders to provide input about known safety concerns in a specific area or perceived notion of safety for their facilities. So we do not intend to include fatality or serious fatality or injury data or crash data to this tool. That's going to be looked at separately.
Another tool question, what years of accidents should be included? Last 5 years?
No, so the tool will this online reporting tool is not to input crash data. You know, the crash data, we have access to crash data through our data Bureau of Data Analysis. So I want to discourage everyone from inputting crash data. This is more to input areas of potential safety improvement or a perceived need for safety improvement in their facilities. Now, as far as the crash data analysis, we will be looking at the very minimum 5 years of crash data, if not more, to help us identify trends in crashes, fatalities, and serious injuries. Anything to add in there?
Yeah, I would say for pedestrians and bicyclists, I agree. We probably need to extend the database that to a longer period of time to make sure that we really understand, you know, what is happening at those locations, and also understand, you know, where the areas are across the state that we want to make sure that we focus, because we certainly don't want to overlook areas that are really have seen some issues in the past that might not have seen them in the more near term.
Yes, Kim, that is a great point. You know, part of the purpose of this tool is to help us to identify risk areas for vulnerable road users that we may not be able to capture through looking at the crash data.
A big question that's coming in is how do I stay involved? And does attendance to this webinar put me on an email distribution list to be updated about future webinars and participation events associated with the VRU?
Yes, so that has been the million-dollar questions. How do we ensure that we have all stakeholders included in our master list? So we relied heavily on the Bureau of Local Roads and Streets circular letter to send out this first invitation. Now, since anyone that was registered or attended this webinar will be included in future communications. And also we are working with other efforts that are ongoing in the state, such as the Active Transportation Plan, to ensure that people that are involved in that effort are also included in these efforts. So you're here, which means that you will continue receiving emails from us. Also, if anyone has any suggestions or questions in the future, please send an email to that dot.vrusafety@illinois.gov email. That is an inbox that was specifically created for this effort. So please make sure that you, there it is, that you save that email and for future comments or questions.
Do we have time for additional questions, or would you like people to email any further questions?
I think that we can take a few more questions.
One of the questions was just about explaining the categories in the tool a little more. What does request bicycle facility or request pedestrian facility mean, and what's the purpose of these categories?
Yeah, and maybe, I don't know if you want Chad to bring that back up again and show that. But again, this is really to gather information from you to be considered in the process. So if there's an area that you think would benefit from a bicycle lane or pedestrian accommodation, please add that in. Again, this is crowdsourced information, so we are going to use this in conjunction with the other data sets to help inform projects and overall recommendations. So it'll be taken into consideration. It doesn't mean there will be a new sidewalk, obviously. That really depends on kind of how that shakes out in prioritization, but having that information will definitely give us a more informed approach.
Yeah, also the
Sorry.
tool may be, these categories are broad enough to allow for a different, range of input from stakeholders. So for instance, if you know that there is an accessibility issue that may be addressed by a ongoing or future project, you may be able to put that information in there as an accessibility pin per se. So to answer a question from Mike on the chat box, you may be able to include anticipated locations or issues to be addressed by proposed development as well in this tool.
There's a question about including anticipated locations or issues from proposed development. I assume when you're talking about proposed development, you mean kind of land use development and anticipated consequences related to accommodations as a result of that land use development. And if that's the case, I think it would absolutely be helpful to have that information because it's an anticipated future need. I think that would be good to include. If you have projects that are in the program already and you have that in GIS, that's something that we can incorporate, but you do not need to do that in here in this tool. We can coordinate with Juan and team and gather that information separately.
There was a question about wanting to see who else is adding points in your area so you're not duplicating entries.
So that's going to be very hard for us to control, as this is a public-facing website. If there is duplication of input, I think that's something that can be filtered later. Just one recommendation is, as you input new points, make sure that you refresh the browser so you see what's being inputted in real time. So we don't have a master list as to who has been using the tool, and I don't think that we can do that since everyone that is inputting is considered to be a single user, and we did that to keep the tool as open as possible and encourage broad use of the tool.
And there's one question about time frame and how long it will be open. Not sure if you touched on that one yet, Juan, but we really anticipate this at least being open kind of to gather that initial input through at least probably through April, I would envision, so that we can use that as we start to have more detailed discussions with you. And I would say if there are any more like detailed discussions or questions that are kind of area specific or geographic specific or jurisdiction specific, we can absolutely have those conversations and we can get into more detail as we need to. So I would suggest using it, exploring it, and as you have additional questions, then reach out using the email, and then we can set up additional time to go through it as needed.
I am going to address here the last question for today, I think. We currently do not have any press releases or for the publishing of this tool. We hope that this could be something that could be distributed through this effort. We will also make this tool available in our website for the public to access. But we encourage every single one of you to distribute this tool as you see is appropriate. Once again, I want to encourage you to get involved, to contact us via the dot.vrusafety@illinois.gov inbox. We were going to be continually monitoring that, also providing any input that you may have through the online tool that we have created, and reiterate that we are very excited about this effort. We are fully committed in taking a data-driven approach to vulnerable road user safety, and thank everyone for taking the time to attend this session.